when the rain is established completely and there is wet, rainy weather. Every day there is rain, hardly there is some time which is rain is not falling, and all the things. The weather is also changed completely. Rain has started, rainy days are established. So there are various different complaints. If with rain, this is the symptom, this is the complaint. With rainy weather or with that change, if patient takes cold, see, try to understand, it is not cold in every season, every change of season, but with when rainy season is there, when rain is there, when the wet weather is there, and patient has disposition to take cold. Very common, but uncommon for this particular complaint, the medicine is Calendula. You will never think about Calendula for this. Give Calendula and see the result. But precisely when you will be giving Calendula, when the patient is coming with disposition, every rain, the change to rainy season and the cold starts. We may think about Dulcamara, we may think Mercurius, Pulsatilla, Rustox, but Calendula will never come to our mind. So it is the most neglected remedy for this tendency to cold. Then there will be nasal congestion. If nasal congestion in warm, wet weather was there, it was Kali bichromicum. If the same congestion of nose, whenever there is rain and cold environment is there, along with that there is nose block, first medicine you will think is Dulcamara, cold and damp. Here it is damp, fully established, still not yet that cold. If it is only nasal congestion, nose block during rainy weather, but not that cold, it is Nux moscata. Nux moscata is parallel with Dulcamara for this complaint. But Dulcamara is sudden change, very cold and cold damp. If then rain stops, Dulcamara is the medicine. So this is how we are differentiating. This is how we are playing with the air in rainy weather. Flu and coryza is there. Then you will not think about Rustox. It is rain, it is established, but then it is Mercurius and Pulsatilla. You will definitely take the generalities, but then when patient says I am having thirst or thirstlessness, you see the tongue, you observe the oral cavity, and you find it is Mercurius. Mercurius is the medicine for that time. Pulsatilla is the medicine for that time during rain, and patient has coryza. About partial hearing or partial loss of hearing, or they may complain about deafness, or many people they say that it aggravates during this particular time of change when rainy weather establishes. Then again, like your disposition to cold, Calendula is the medicine for deafness. Calendula during rainy weather, Calendula is the medicine. Then there is throat pain. When patient comes with throat pain during rain, again, the medicines are Rustox, Dulcamara, and Calcareacab. Rustox is definitely important medicine, but Dulcamara, when the rainy weather is there, when patient takes cold, and like Baraitacab, every cold settles in the throat. Like that, Dulcamara has in rain, every coryza with that patient's throat will get affected. So if patient comes with throat pain, rainy weather, then Dulcamara should come to your mind. But if it is simple coryza, if it is only nasal congestion, weather is not that cold yet, there is no sudden change, at least you can spare Dulcamara for the later issue. Then there is laryngitis. See, when laryngitis comes, there will be pain, there will be hoarseness, there will be change in voice, there will be inflammation, soreness. So if laryngitis is there in rainy weather, like your warm wet weather, nasal congestion, here Calibichromicum do play an important role. So with laryngitis, throat pain is Dulcamara. With there is hoarseness, with laryngitis, patient may come with little fever also with that. Then Calibichromicum, but the symptoms of Calibichromicum should be there. If you get that symptom, but you don't understand whether Calibichromicum is a medicine for this phase or not, yes, it is the medicine. You can definitely think. Chest operation, still not talking about anginal pain, but patient feels heaviness. When this heaviness is there, Dulcamara, natrum sulph for asthma, you can think that medicines, they are important medicine. But when patient complains about operation, some heaviness, some kind of discomfort with heaviness, medicine would be Kali Carb along with Dulcamara and natrum sulph. So for chest operation, kali kav, dulcamara and natrum sulph. Dulcamara, natrum sulph is definitely we know, but kali kav is equally important remedy when rainy days are there. Asthma, definitely dulcamara and natrum sulph. Differentiation I would discuss just in earlier slide. There'll be joint pain. When rain is there and joint pain, Rustox we know, but suppose if your Rustox is not helping, then back of the mind, you must prepare another medicine, and that very important medicine during rain, if there is joint pain, rheumatism, is colchicum. If you consider rhododendron has no role to play here. Rhododendron was much before, when there was warm weather, when there was clear weather, rough weather. When it is rainy weather, then it is colchicum. It runs parallel with rustox. And when it is with gastric affection, colchicum becomes very important remedy when we are talking of joint pains, rheumatism in rain with gastric affection. Neuralgia. This is also a common medicine, but for uncommon complaint, especially brachial neuralgia, neuralgia of large nerves, big nerves, subscapular neuralgia. Patient will complain about that. Usually you are going to forget this remedy. You will not remember this. The medicine would be terebinth. It's a very important kidney remedy during damp season, but equally important neuralgic remedy. So when patient complains, but neuralgia of big nerves, large nerves. So that is terebinth. Diarrhea, which is common in monsoon, but when it is only in rainy phase of the monsoon, this is dulcamara and natrum sulph. I am not talking about diarrhea from overeating, diarrhea from eating all this, pakodas and corn when you go out to take ride in monsoon. But it is not with that. It is not the gastroenteritis or not any gastric infection, but it is basically due to the change in the season, which brings loose stool. And diarrhea of dulcamara and natrum sulph. Natrum sulph, we all know it is a medicine for morning diarrhea, early morning diarrhea with flatulence. So there is again a difference. But this medicine, you must think. Abdominal pain. When we talk about abdominal pain during rain, when it is established rainy day, along with dulcamara, there is very important medicine is manganum. Manganum is a medicine for monsoon. It is important. Dulcamara, natrum sulph, and manganum. Manganum is definitely, so far this medicine was not there anywhere. But the moment you talk about cough, the moment you talk about abdominal pain, during monsoon, during established rainy days, manganum is important medicine, very important medicine. Once the weather is established completely, every day there is rain and waterlogging is there and rains almost for 5, 6, 7 hours a day. So the weather now becomes humid and wet. Established cold, wet weather. In cold, wet weather, cold tendency in rainy, disposition to take cold in rainy is calendula. But when that tendency is already there, which aggravates during the change, damp, cold, then it is dulcamara. Very minute differentiation, but if you can do this differentiation, or if suppose you have given dulcamara and it does not work, or you have given calendula and it does not work, you can think other medicine later on. So your mind should have this as a backup remedy. Cough. When in cold wet weather you get cough, here you can see when it becomes cold, it becomes damp, it is definite cold, everywhere you see dulcamara's priority. Dulcamara will come on the top. So cough, then dulcamara is definitely an important remedy. Asthma, like dulcamara and natrum sulph. Everywhere, retention of urine. Many times it happens when patient is exposed to this type of weather. Either they have retention, or very commonly old age people they come and say, or even normal regular people they say, frequency of urine has taken place in this change. So retention, dulcamara is important, and along with dulcamara, aconite is very important medicine. For only cold, damp, when it is established cold, where you don't require AC, even you don't, many times you require fan, it is almost, you are experiencing winter-like cold along with humidity. But if it is frequent urination, retention, you will think about dulcamara and aconite. If it is frequently patient has to visit the restroom, then the pulsatilla, sarsaparilla, these are the medicines in cold, wet weather, urination frequently patient has to go for. that is pulsatilla and sarsaparilla. These two medicines are important. Again, there is diarrhea when established. See again, Dulcamara. So Dulcamara is a remedy you can see in various spheres, various effects, but the cause, the phase has to be very clear for Dulcamara. Urticaria even, Dulcamara is a medicine. But what is the change? Oh, sorry, what is the differentiation of Dulcamara's urticaria? That Dulcamara has amelioration by cold. Though they get urticaria in cold, but still it is ameliorated by cold. Whereas Rustox, they get urticaria in monsoon, in rainy season after getting wet, but which is ameliorated by warmth. You have to, this is very minute differentiation, but if you get them from the patient, your prescription is absolutely sure and patient will be relieved within no time. The thing that all majority of us love, to go out in rain, to have bike ride or cycle ride, and we get wet and we enjoy that drenching. But if you remain like that, if you have good vitality, you do not fall ill, it is fine, it is pleasurable. But if it is having, if it is causing some complaint, getting wet is a big cause for patient. Now we can understand it in two manner. Either you get yourself wet, you drench, you get drenched in rain, or you walk through the waterlogged area, you walk through the puddle and only your feet get wet, your socks get wet, and that wet socks is on for say few hours. So your feet getting wet and you whole getting wet, drenched. For getting wet in general, for any complaint, majority of the time, it is Rustox. Rustox will cover almost all the ailments when you have, when the cause is getting wet or you have drenched in rain. And similarly, getting feet wet, when your feet only are wet because of, walking through that or due to some like working in water, very important medicine is Pulsatilla. These two will cover majority of the complaints, but still there are certain exceptions. So let us take very fast. If it is headache after getting wet, Rustox and Pulsatilla are both important, but as I have told you, Pulsatilla is after getting feet wet, but Rustox is on and on. From simple headache to even meningitis. After getting wet, if patient develops headache, it could be simple congestion or even it could be pathological level up to meningitis. Rustox is very important for that acute effect of this cause. Don't think about that Rustox is a rheumatic remedy. How can Rustox remove headache? No, Rustox is a ranking remedy for this. But if it is coryza, I was just saying that, there is some exception. If it is coryza after getting wet, you can give Rustox, but if Rustox will not helping, then you can definitely, this is another important medicine for that, it is sepia. Sepia will help relieving coryza after getting wet. This is very rare, but suppose if you get nosebleed after getting wet, summer epistaxis is very common. Nosebleed is not that common in rainy season because the climate is cold and usually people will not come with that. Normally people may complain about nosebleed during epistaxis during summer. And very important medicine for that is Crocus sativus. If patient complains that in every summer I get epistaxis or nose bleeding is there in summer because of high temperature, my kid is getting the same. So it is Crocus sativus, which is very important medicine during that, but it is again only in that phase. Not every epistaxis will be relieved by Crocus. So if similarly after getting wet, if patient develops nose bleeding, then it would be Dulcamara and it would be Rustox. But if after getting feet wet, it is Pulsatilla. So here there is a difference. You have to ask your patient after what you have got this. Fever. If patient is getting wet and following by that, if patient develops fever, Rustox becomes very important. But in monsoon fever, there are many other medicines. If we consider intermittent fever, if we consider malarial fever, if we consider dengue, so this all becomes very important in monsoon. When fever after getting wet, Rustox is ranking medicine, Pulsatilla after getting wet, and Calcarea carb is only when fever after getting head wet. Rustox is ranking remedy for fever after getting wet. We are talking only of getting wet. After getting wet, what are the complaints? So I am talking only about Rustox. Rest of the fever medicines we'll discuss later with later phases. Now this is important. Bell's palsy. Medicine is causticum. See, again, it is very important that, if getting wet is the same cause, why not Rustox? But the effect is different. So this is an individualization. For the same cause, if effect is seen on something else, where the pathogenesis to that particular area is different. For Bell's palsy, after getting wet, the medicine would be causticum. If it is paralysis, if it would be paraplegia, then Rustox is important. But only facial palsy, causticum is ranking. It is much higher than that of Rustox. Urethral pain, again, Calcarea carb. Rheumatism. See, we had discussed earlier, when there is cold, wet weather establishes, along with Rustox, colchicum is a ranking remedy. So far, colchicum was not there anywhere. Not in storm, not in warm, wet weather, not in cloudy weather. But the moment weather becomes cold and wet, with rheumatism, with gastric affection, colchicum is important. Pulsatilla, definitely after getting feet wet. So Rustox and colchicum runs parallel for this affection. Here it is important. In wet weather, we said manganum is important, abdominal pain, colic, along with Dulcamara. When colic is there after getting wet, especially after getting feet wet, here also it is differentiation with cause and effect. Here you can give Pulsatilla because feet are getting wet and followed by that there is colic. But suppose if patient is not improving, then so after getting feet wet, patient complains about colic, the medicine would be Allium cepa. And it is not only the colic after getting feet wet, Allium cepa is very important remedy. You have to think beyond than the coryza, acrid coryza and bland lacrimation. Allium cepa is again a medicine for colic, especially when patient or person is eating cucumber, eating salad. So post salad, post cucumber, when they eat something like that, and then they experience colic, Allium cepa is very important. But getting wet, getting their feet wet is Allium cepa. Diarrhea after getting wet, again Rustox, on and on. You can see whole, if you are drenched in rain, if you are getting wet, it is Rustox. Convulsions. After getting wet, convulsion is there. Cuprum mat is definitely, cuprum mat is a ranking remedy for convulsion, but after getting wet, don't think for Rustox. Then go for cuprum mat. It's very important. And as I have told you, paralysis. Along with causticum, if it is paralysis, then it is, but only facial, it is causticum. If it is paralysis, then you can think about Rustox as well as causticum both after getting wet. Urticaria after getting wet, we had just discussed with Dulcamara. Here it is not Dulcamara, here it would be Rustox. And the modality for Rustox, ameliorating modality for Rustox would be, they are better by warmth. Dulcamara ameliorating modality, though it is caused by cold, they are better by cold. These people are better by warmth.